Good evening to you and welcome to today's edition of the program, Doctor on Call. We are told that your health, of course, is of great importance to you, and that is why on today's edition of the program, Doctor on Call, I have two great practitioners talking about medical experts for us to take a look at the activities and, of course, the industry of health. On my right, I have Dr. Talibu Wycliffe is here with me. Doctor, welcome to the program.
Thank you. Good evening, everyone.
And I've also have with us in the studio here this beautiful evening to take a look at our health situation in the country is Dr. Olusegun Ajaun, MON. Welcome to the program.
Thank you very much.
These two gentlemen have seen it all when we talk about health, of course, because Dr. Talibu Wycliffe is a consultant, of course, gynecologist with the Federal Medical Center in faraway Kefi. Of course, he's with us right here in the nation's capital, Abuja, on today's edition of the program, Doctor on Call. I also have with me in the studio a former, talking about the CMD of National Hospital, MON. He was also one time a former physician to former President Olusegun Obasanjo. And together this evening we'll be looking at the activities and of course the industry of health in the Federal Republic of Nigeria. Let me start with you, Dr. Olusegun. When they say a doctor is on call, what does that really mean?
It means the doctor is available to attend to patients and it's not far away. That's it shows availability, that the doctor is available to see a patient. And that's what we call people that come to us patients. You are available.
So the patient will have to wait for the doctor, or the doctor is within the premises, but not on his desk. Is that what you mean?
Most of the time when you say you are on call, the doctor is seated. But in most hospitals, it's not just one doctor that is on call. So there will be one that will be seated, and the other ones that are on call, maybe senior to the person that is seated, is available. Maybe just a telephone call away. But doctor on call means doctor is available.
And I'm glad to let you know that Doctor on Call, we have two doctors this beautiful evening here on your #1 station, Global Television, coming your way live from Nigeria's capital city of Abuja. Let's go to Dr. Talibu. Let's look at medical industry in Nigeria. A lot has been said about Nigeria. A lot of people embark on tourism medical situation. Is it that Nigerian medical doctors have not arrived, doctor?
No, that will not be a very good way to look at tourism. When it's medical tourism, somebody might have seen the way his friend is treated elsewhere and we want to get that same kind of treatment. Something else might have attracted the person. And it has nothing to do with the fact that Nigerian doctors have not arrived. It may shock you to know that every year, many people come from outside the country to Nigeria to receive treatment as well. So it is not telling on the capacity of the Nigerian doctors, but it may tell a little bit on the capacity of the health system, especially on the perception of that capacity. That some people think that they may get better care outside. That is perception. It may tell on that perception, but not on the capacity of the Nigerian doctor.
Now, Dr. Olusegun, let's look at the industry, the health industry, generally. Is it that the corporate body or the patient or the government have not done enough in terms of funding and then making our hospitals superb #1 for us, so that the issue of going out should be a little bit controlled or perhaps at the minimal miss?
Let's put it in its proper perspective. A patient has a choice to say, this is my problem, this is where I want to go. And that is actually based on either it is close by, it is affordable, and from the report, they have reliable services. So these are issues. So a patient has a right to choose wherever he or she wants to go. The government has a duty to provide the minimum working condition. so that when the patient goes to see the doctor, he or she is not disappointed, because it is possible the doctor knows what to do but does not have what to work with. Also, previous stories of that either the doctor or the facility that the patient has had will also determine whether a patient wants to go there or not. Emergencies, a patient has no choice. It is wherever the patient is taken to that he finds him or herself. But it is not just the patient, it is not just the doctor, it is also the facility. So the three has to work together, because if a clinic or a hospital is so named that there is nothing to work with, that is to say, in terms of making diagnosis, you need laboratory is not adequate, you need to do investigations, the machines are not working or not there because either the budget is not released or anything. That will affect the confidence patients will have. People that have a choice, it will affect their, whether they are patronize such place or not. So it is a combination of not just the patient, not just the government, but the health worker also. It has to be a combination of everything.
We are right here in the nation's capital, Abuja, and we're looking at the program Doctor on Call. I have two gentlemen who have seen it all. Dr. Talimu is, of course, right here with us in the studio, and, of course, Dr. Olusegun. Dr. Talimu, you are still practicing. Tell us the challenges. Are there really challenges that doctors, because sometimes patients find it difficult when they can't see their doctor. Could there be any bottleneck that is depriving them from seeing doctor?
Well, this is a bit of a complex question because if there are scheduled timings of seeing a particular doctor, it means that at other times that you are not able to see him, he may be performing another duty elsewhere. If, for instance, in a regular tertiary institution in Nigeria, in a week, every day is divided into activities. If the clinic days are just on Mondays, at particular hours of 9 a.m. perhaps to 3 p.m., you will see the doctor at that time. But if you come on Tuesday, the doctor may be in the theater. If you come on Wednesday, the doctor may be teaching people elsewhere. If you come on another day, he may be carrying an audit somewhere, and so on and so forth. So when the patient comes and discovers that he cannot see the doctor, it does not mean that the doctor is not available. The doctor is always available, but may not necessarily be at the beck and call of the patient, meaning that it is not any time the patient wants that a doctor must be there, but things are scheduled. That is why a patient cannot always see a doctor. The second thing is that sometimes the doctor, just like the patient left his work to come to see the doctor may have also had a personal thing. Doctor is a human being. He has children in school. He may want to go to school. He may also have taken a relation to see another doctor or for something else. These are the reasons why a patient may not see a doctor.
Doctor on Call on your #1 station, talking about Global TV right here in the nation's capital, Abuja. Dr. Olusegun, you are retired but not tired. I've told you, you're very, very active. Let's look at the situation where some medical doctors are, or perhaps would prefer their private hospital than the public hospital. Is it that there seems to be some level? What is the difference between your primary point of duty and then the one you offered somewhere? Why should we still have such?
Well, if you are engaged in a particular health facility, there are hours that you are supposed to be there. You have to be available. If you also happen to have a private or another place, it has to be properly arranged that there is no clash. I mean, I had the opportunity of heading a public hospital. And if specialists, consultants, senior doctors, you don't have to be available all the time. There are people that are on ground. But if you are supposed to be available, you have to be available. So it will be maybe unethical for you to be on duty in a particular hospital, whether it is public or even your own, and the advertised hour is there and you are not there. It will be bad. Unless, of course, you have a cogent reason. Maybe you yourself, you are falling sick or something, or maybe somebody, maybe your family. But an arrangement has to be made for somebody to cover you. So it would be wrong for you to be in two places at the same time. It should be timed. So if you are supposed to be in a paid employment, there are hours of work. So if it is not 4 o'clock or your closing time, you have to be available. It will be unethical, probably illegal, for you to use use your official time for your own private work. And I think it is not only doctors, even other public servants. So a time a doctor is supposed to be available should be advertised. The hospital opens 24/7, but it's not everybody that will work 24/7. There are shifts. But if you are supposed to be available, you have to be available. If you are not going to be available for whatever reason, then an alternative has to be made by the hospital to make sure somebody else is there.
Dr. Let's look at our rural area where we ensure that our brothers and sisters who are far away in the rural area, what type of medical facilities or personnel, what satisfy such people to carry out their activities? Is there a measure? I'm looking about the type of quality healthcare services we receive from this rural area.
Well, if I get you very well, I will answer that the medical system in Nigeria has cadre, and the system is such that there is primary healthcare, secondary healthcare, and tertiary healthcare. In the rural area, it depends on how the place is. They may have a primary health center, or a comprehensive health center, or a cottage hospital, a general hospital, which are secondary health centers, or a tertiary health center. Those in the rural areas, it's expected that their common ailments will be taken care of by the people who are there. So medical cadre are placed there in appropriate number to the ratio of the population, so that they can attend to the issues that they have. And if the system works well, there is a mechanism of connecting these people to the next cadre should such a problem arise that is too much for this kind of people. I don't know the very motivation that makes people work in rural areas, but most times it is because it's what is available to them. Other times because that is their state. Perhaps someone's husband works there and she has to just stay there and also work or so. But it is the same work that is expected of the medical profession. Do your own, and if it is too much for your level, you send to the next level.
Dr. Olusegun, yes, how would you rate Nigeria medical?
I think we should also be fair to ourselves. Primary health care that is supposed to take care of majority of the people, because it's like a pyramid. I don't think we are doing too well, and the blame is not only one person. Because if I have a general hospital in my hometown, there is only one doctor, and the doctor, there was a time when the doctor travels for weekend, so which means throughout that Friday, Saturday, Sunday, there's no doctor on duty. It's only nurses and the other paramedicals that are available. If you are the only one and you have to work throughout the week, the job will not be done properly. And as I said, he has a grandmother who is not in that town and has to travel. There was a time where we had to sit down and talk that, look, if you know you do not like this village, or this is not as big as your town, why don't you say it officially so that they can give us a replacement while we make efforts to get another hand to join you. So sometimes the workload is too much for one person, or for the number of personnel that is there. Another thing that, may also be said to say, how do we rate the primary healthcare is also supposed to provide immunizations, and there are midwives are supposed to be there. If you do not have enough, then you will not get the best. Also, if the vaccines or the vaccine carriers or the storage facility is faulty, you will also not get the best. So far, to be frank, the way I look at it, I'm not too sure our primary healthcare is functioning maximally. And it is not only the fault of the personnel. In fact, I don't think the personnel will have very little fault. It is the government that should provide the medicaments that are failing. If you go to the secondary, again, not much attention is paid. They have more doctors, but you hear of one strike or the other. Today, the nurses are on strike, the doctors are on strike, maybe the laboratory or the other health workers. So even at the secondary level, there is problem. If you now come to the tertiary, which means there should be, our tertiary level too, you find that we are probably not operating at the level that you expect us to be functioning. All of the three levels that are mentioned now, they are all supposed to be connected. Dr. Da mentioned at the other time that once you get to your level, at the limit of your level, you should be able to refer. Maybe the roads are not, the connection is not good, the road, and it takes a longer time. So because of that, you find that people in the primary or the secondary level might delay a patient longer than usual. So if you now look at the tertiary, where you have not just treating patients now, they are also training, they are also supposed to be doing research. Definitely the facilities we have as at now, we are not doing well.
Dr. Let's look at Abuja, the nation's capital. A visit to some of the primary health tells you that we lack hospitals in Abuja. What's your take in terms of the availability of medical facilities in Abuja?
Well, if you say we lack medical facilities in Abuja, we will sound...
Not being enough to cater for the huge number of the residents of Abuja.
I want to think that, yes, not enough, but in some sense, if the number of facilities in Abuja, in some sense, if they were put to proper use, will cater for the residents. While there is...
You hear people saying there are no space at the public hospitals,
yes,
like the one in Maitama,
yes,
the one in Asokoro,
yes,
the one in Gwarimpa. You hear
yes,
people complaining there are no space for patients.
Yes, the system in Nigeria is such that 50–60% of medical care is provided by the private sector. And usually, that is more costly for people, so they tend to go to the public sector. And many times, perhaps those who sought and thought out the capital of the nation, at the time they were thinking this, were using the figures that were available. Maitama, Asokoro District Hospital, and so on, were meant to be 60-bed facilities. But now they are like 200 beds or more facilities. And it may be possible that despite the expansion, you may not find facilities in their optimum functional order to cater for people. If we achieve the utilization, the proper utilization of what we have, we will have moved very closer to providing healthcare to people. But there is room for improvement. And if it is Abuja we use, if the private and the public are used judiciously and optimally, I would say that people are going to get much care. Now, the policy that divides primary healthcare, secondary healthcare, and tertiary healthcare seems to be in the books and in the government books, because the general patient doesn't know. So you see malaria going to the national hospital to be treated. That should not be. It should be treated in the person's closest place. Then there is this wrong sense that makes us think that if you are wealthy or highly placed, you won't go to to a primary health center. So that we need to create in the minds of the people that you utilize the closest primary health center to you to treat your diarrhea, your malaria, a small thing. So that by the time you come to the tertiary institution, it's a filtered thing. Then the space that is available will go around. But if the space is filled up with somebody who had fever, whom the doctors will be thinking, should we admit him, should we not? And he occupies a bed, certainly the beds will not be available. If simple deliveries are have to be taken at tertiary centers, then the beds will not be available. We should have a reorientation where people should not think of primary health center as a place for those who are less privileged. It is the hospital that is nearest to you in terms of the care you should get and the proximity. And it should be your first port of call so that you do not clog the other systems and then make it look as if it's just not sufficient.
Doctor on call on global television right here in Nigeria's capital city, Abuja. I have been talking to Dr. Talimu, who is right here in Nigeria's capital city. He's a consultant with the KP Medical Center. And of course, sitting by my left is also a former medical director of the National Hospital Abuja. I'm talking about Dr. Olusegun Ajonwo, MOON, right here on this beautiful evening. Doctor, let's look at, so what can we do to improve or to send the positive signals to patients that public institutions are capable, can be able to treat people better, because people seem to be running to private sector. What is the lack in there?
Well, if we have to, I mean, I've worked in all the levels of government, of healthcare. I've been exposed to primary healthcare, I have been exposed to secondary, and I train in the tertiary. It is like Dr. Das said, it's not everything that should go to the tertiary or even the secondary. So, and there is no, we shouldn't deceive ourselves too. We are not paying enough attention. Government is not paying enough attention to health because the allocation to health is definitely not enough. It's not adequate. And to also now think that even the inadequate allocation does not get to the hospital is another problem. It's another problem. Also, what we should also encourage the well-to, especially the politicians. I don't think they are doing us well enough because they disrupt everything. Things that can be done easily, they look for, they said, they want the specialist, whereas it's a simple thing that can be handled by other doctors that are not specialists. So I think because that sense of, no, I can't be sitting, I can't be waiting, I can't be sitting with ordinary people, isn't there? So you find that because they use private facilities even for things that do not have to go there, and that leads to neglect of the public facilities. So you get to a private hospital, even the very highbrow clinic. There was one time there was a cry out at the State House Clinic, does not have cotton wool, does not have spirit. So we find that, especially the politicians, we have to appeal to them that we should pay better attention to the health facilities, especially the primary and the secondary levels. And then the tertiary levels should also be thinking of better ways to generate more funding, not just depending on government alone, because there's no reason why we cannot be attracting grants for the tertiary hospitals from donor agencies. So I think it's the fault, or if there is the problem, is across the board. But I think we're not having it easy with the attitude of government to public hospitals. It's not good enough. There is definitely a lot of room for improvement. So that let's pay more attention to this primary level, and people will then have confidence. Because if you go there and the number of doctors on duty, they are not enough, and you have to wait from a whole day to see for a simple thing, you probably would prefer to go to the chemist.
Okay, Doctor, let me come to you. You heard Dr. Olusegun saying enough attention is not given to the medical sector. If you were to advise the government, at what point will you say it should increase?
We know the stage of things in Nigeria, and we know the style that is used to salvage a system that is almost completely collapsing in terms of the difficulties that the system is facing, especially in funding. At the stage that we are, we have seen how we are having brain drain. We have seen how during the COVID, the then SGF said he never knew the rot in the medical system. We have seen how some people are already thinking that the rot is responsible for medical tourism. We have seen how we are unable to handle certain epidemics. At this stage, what is needed, just like was done for aviation,
yes,
a bailout was given.
Okay.
A bailout was given to the banks when there was a crash.
Is that an appeal?
A bailout was given to everyone. At this stage, the medical, the health sector needs a bailout.
Okay.
A bailout in the sense that not in the regular route of creating contracts that has to be proven in the National Assembly and so on. No. Maybe a special committee of people will be sent to hospitals. They will know their problem of each hospital, and a bailout in the sense that some lump sum will be given to each hospital from primary to secondary health care. The other advice is in terms of personnel. Even though there is an embargo on employment, there should be no such embargo on the health system. 1, because there's brain drain. 2, because people are retiring. 3, because in the training of residency, for instance, a time is pegged that after this time, this doctor will go. We don't have to wait until a replacement. It should be automatic replacement. Those are my 2 main complaints. My advice to the government.
It's time for us to go. In fact, it has been a wonderful time having you on today's edition of the program, Dr. Onkol. Dr. Dan, thank you very much for your time.
Thank you very much.
I want to say a very big thank you to the OON, talking about Dr. Olusegun Ajohun.
Thank you.
Finding time to be with us here on today's edition of the program, Dr. Onkol. And of course, your #1 station, Global Television. Join us same time on another fresh edition of the program, Dr. Onkol. We shall be X-ray, but this evening we'll be going home with an appeal that much is still needed for the medical sector. Until we come your way, have a wonderful evening and enjoy the rest of the day. And